Good afternoon, everyone, and thank you so much for taking your precious time out to join this all-important session on eye care, where we are going to discuss multiple issues which we are facing, starting from dry eyes, computer vision syndrome, and many other, eye and refractive issues which we all are facing nowadays. We have with us a renowned eye specialist in Dr. Kavita Rao. She practices in Aditya Jyoti Hospital, which is a unit of Dr. Agarwal Eye Hospital, Mumbai. And she is a director, cornea, cataract, and refractive, surgery services in the hospital. What we are going to do in next 50 minutes or so, going to hear from Dr. Kavita about various aspects of our eye health. What are the commonest problems which we have? What are the preventive ways? And what are the treatment modalities which are available? At the end of the presentation, we will keep 10 to 15 minutes for the question answer session. Dr. Kavita, I'm going to read the questions from the chat box, taking to you. We'll be clubbing few of the common questions, bringing to you, and we'll be waiting for your answers. So thank you so much for joining, Dr. Kavita, taking your time out. We know that we have come straight from a surgery, and thanks for giving your valuable time to educate people. Over to you for your session for next 50-55 minutes.
Thank you so much. So my talk I basically divided into two presentations. So first, I think it was on request to just talk about computer vision syndrome and dry eyes and general eye health. I think it's a very hot topic because computer vision actually it covers all the screen that we use, including mobile, or it may be your iPad or whatever, so all the screen time that we're doing, how it is impacting the eyes, and how do we prevent that, and if you already are affected by that, then how do we get that treated is what I'm going to just focus on. And though parts of the talk may look a little technical, but the only reason of not making it like too simple is so that you know that there are so many advances in the way we treat these problems as well. So what is this dry eye problem that we are talking about? So when we look at the eyes consists of eyes like a camera, and there are two lenses in the eye, and the front lens is the cornea. So actually this cornea is covered by tears. So it is the first lens of the eye, so to speak, and reduced quantity of tears is called as dry eyes, and it affects almost 50% of the population. So what is the impact of it? What it impacts, if you feel like, in what ways, when I see a patient with dry eyes, how is it impacting the patient? So, it's not only impacting his vision, which is what we typically feel, but it impacts his overall health, the sleep, psychological health, level of independence, all of that. The patient with extreme dry, sometimes even unable to walk into my, consulting room independently, needs somebody to hold him. So what are the activities which can be affected? Like I said, the patients can get affected with reading, driving, computer use, professional work. I often find a lot of professionals, IT professionals, which includes probably all of you, when they are at the end of the day, they feel extremely tired. So even on their off days, if they want to read something, they feel they're not able to, or even on their work days, they're not able to concentrate on the screen when they're looking. They feel the vision is not clear, or reading a little bit is giving them a headache, or driving is affected. Sometimes during driving, maybe they are not able to see properly, or getting headaches. All their professional work could be affected. Now when you look at dry eyes, you feel, what's the big deal in dry eye? What exactly, how is it impacting us? But if you see, this is a little technical for you guys, but what I'm trying to here impress on the fact is that if you have moderate dry eye, then it's actually comparable to having probably a moderate angina. And if you have severe dry eye, it's actually comparable to having a severe angina. What is angina? Is basically a heart attack or a hip fracture. So patients who have severe dry eyes, it impacts their life, similar to having a cardiac issue or maybe even a hip fracture. So it's not something to be taken lightly. So it's very common, but sometimes can be difficult to diagnose. You can see that, as I said earlier, 50% of population will have dry eyes, some amount of dry eyes, out of which 30% will be actually pretty much severe. So it is frequently, it is underdiagnosed. And, for us, we have so many modalities to diagnose dry eye. Just a little bit about the tears. What is the, as I said, there are 3 layers in the tears. And once these layers get affected, that is when you have dry eye. And if you see evaporative dry eye, it is when your tears are getting evaporated faster. Now that happens in computer vision syndrome. When you're continuously looking at the screen, you're not blinking. So that's when your tears evaporate from the eye and it causes the dry eyes. So most of the patients, if you see, 86% of the patients are lipid deficient. That is the evaporative dry eyes, which is the computer vision syndrome patients. As you see, these are the risk factors for dry eye. If the age is between 21 to 40, males, smokers, contact lens users, and 89.98% of patients who use the any kind of screen for more than 4 hours. So if you can see, I think almost the entire population, including kids nowadays, it's not only adults, especially with the post-pandemic entire, if you see, even now we are sitting on a Zoom doing this call where you're forced to look at the screen and forced to see what's going on. So on the screen, it's not like earlier where it was more like a live interaction. So like most of the times, it is your screen time which is the culprit. So that is what is a generic name for using screen time, which is computer vision syndrome. So how do you know if you're suffering from it? You could probably have blurred vision, you could have headaches at the end of the day, you could feel that your eyes are dry. Like some patients actually just they have their diagnosis themselves, or the eyes are itchy, you feel tired at the end of the day. Now how is your doctor going to diagnose it? And how is he going to tell you, like slotted, is this mild, moderate, severe? He's going to look at all your symptom signs, do a complete thorough evaluation, look at the risk factors. When you come to us, we usually give you a questionnaire like this. So we want to know how is it impacting you. Is it impacting your, what activities are impacting? So what are your symptoms? Are you sensitive to light? Are your eyes feeling gritty? Are you feeling sore if the vision is blurred? If it's getting worse and in windy, like some patients say I'm fine otherwise, but when I go to office and sit in the air condition, it gets worse. So, and then of course we look at what activities you're getting impacted with, like where you're not able to read, you're not able to drive, you're watching TV is impacted, and you'll be surprised at how many of these activities actually do get impacted eventually. So each time you come to us, we give you a questionnaire like this, we score this, and look at the reading, and then we know, like each time when you come, whether is there any improvement with our treatment. And also this gives us an idea as to where you're lying in the the severity grade of dry eyes. We have a complete system where we're going to examine the eye, look at the lids, look at all of these are the glands which produce tears. We assess all of that. And this is typical, it's called dry eye because actually this is how it looks. If you have dry, if you see all of these green dots, this is a dye has been used to stain the spots on the cornea. Typically the cornea should not show any spots like this. If you have dry eyes, it's going to stain, your cornea is going to stain. Just a quick technical video to show you that how your tear film actually, if you see the black spots on the eye which are appearing, this is because of dry eyes. So these black spots should not be appearing in your cornea. So when these start appearing, we know that yes, you have dry eyes. So this is how we're going to assess you. You can look at the quantity of tears. We actually measure your tears. You also, when you come to us, typically if you're an average young individual, your tears should be anything between 25 to 35 millimeters. When it goes down, then we know that you've got dry eyes. So we also have a lot of diagnostic tools to help us, which will also study the glands. These are the glands which are producing the lipid part of the tears. So we also study your lipid layer and see whether you've got enough lipid in your tears. So it's fairly advanced, the entire diagnosis of dry eyes. It's not very it's not like you just go to the over the counter, pick up a tear drop. That's really not how it works nowadays, because if you have a lipid problem, we're going to give you a lipid based drop. If you have a aqueous problem in your dry eye, we're going to give you an aqueous based drop. So it is really pretty much advanced. So this is how we're going to diagnose. And management, as you said that we're going to tell you how to manage it. Initially like from your this is all like how we are going to manage if you come to us. But at your level, what you can do is, if you're using the computers, make sure you're taking a break. The thumb rule is 20-20-20. I think most people probably know about this. Every 20 to 30 minutes, take a break. When I say I take a break, it doesn't mean that you have to physically get up from your, if you can physically get up from your seat, just take a round, that's great. But otherwise, what you can do is, just close your eyes or make a conscious effort to blink. If you have some teardrops, use that, like, not every 20 minutes, but at that point, maybe you can use it. And you can look at an object 20 feet away. Now, if you look at the positioning of the screen, you make sure, like, the screen, as you can see, like, I don't know if I'm visible to all of you, but the screen and the, like, should always be below the eye level. Never have your screen at a level which is above your eyes, because if it is above and your seat is lower, it's going to open up your eyes more and cause that much more evaporation and loss of lipid from your eyes. So make sure your seating is very ergonomic. You're seated in such a way that your eye level is either at the screen level or it is above but never below. And entire thing, your back, your legs, all of it should be comfortable, because we don't realize all of all of this is eventually going to impact all of this is the next, all of this actually is going to impact your health. Now, I was asked to talk about blue light from the screen, whether that's going to impact your ability to suggest that blue light is damaging the eyes, that the Blu-ray glasses can help us for a long time. Then for scientific evidence, to show that it really helps. Now, what you can do to
Dr. Kavita, I
ease
think
your
we are losing you in between.
eye strain, like I already mentioned, make sure you're sitting at arm's length, your gaze is downward, take regular breaks from lighting, increase the contrast to if you're using hours. Now, doing all of this, you will be fine. But if this and using probably any over-the-counter tear substitutes, you're still experiencing any symptoms which I talked about, then you must consult your ophthalmologist. This is the correct sitting position, where the screen is on eye level, or probably you can be above it, and all of ergonomic seating that I talked about. Treatment, like I mentioned, once you come to us, we'll know which layer of your eye is affected, and treatment is very, very advanced. We're not really, we're going to focus on, the layer which is missing from your eye, and that's when you will get most of the symptomatic relief. Artificial tears, we have, we give non-steroidal drops, we give punctal plugs, a lot of treatment, like a lot of improvements in therapy, which is again a little bit technical for you all. So I think I will end this talk, and I'm going to move to the next talk. Should I move straight away to the other talk? Is that all right?
Yeah, sure, Dr. Kavita.
Okay. Do you want to take the questions now, or like for this talk, or should I just go ahead with the other? Yeah.
I think we'll be taking all the questions at the end of the session. We'll keep it for 10 minutes in the last.
Invisible?
Yeah, can we go to the screen show mode, slideshow mode? We are actually losing you in between, Dr. Kavita.
Is my screen visible?
The screen is visible. It needs to be on slideshow. Can you hear me?
Okay. So it's not slideshow.
No, not yet. Not yet.
Is it slideshow for you?
Not as it. Not yet. It has come now. Please go ahead.
Is it okay now?
Yes, yes. Please go ahead.
Now, talk about refractive errors, and I'm going to like talk about this not only for adults but also for the kids. So I think a lot of us are wearing glasses, the younger individuals, the older individuals. So broadly, I think any kind of refractive error in the eye is divided into four components, where it's myopia, hypermetropia, where you astigmatism, where you have a cylindrical number, and presbyopia. So myopia is typically what is known, like, by the general layman as a minus number in the eye, where you're not able to see for distance. And hypermetropia is like, it's a plus number in the eye, where you're not able to see distance and near both. And astigmatism is more of a cylindrical number, and presbyopia is which like, which really develops later in age after 40, where you develop reading glasses. So this is how a normal eye is, where the rays of the light are actually falling on the retina. And in a hyperopic eye, because the eyeball is smaller, it falls behind the retina. And in a myopic eye, because the eyeball is longer, it falls in front of the retina. And in presbyopia, because your ciliary muscles become weak because of age, you're not able to see, and the lens also is hardened, you're not able to see the near objects. So we just talk a little bit about why some people have glasses and why some people don't have glasses. Now, most important cause is genetics. Now, genetics is something which you cannot do anything about. Like, obviously, when I say genetics, I don't mean hereditary. It's not that if your father or mother had glasses, you will have glasses. Or like some patients say, oh, but my mom doesn't have glasses. So that's not what it means. So genetics is why you have a certain skin color, why you have a certain hair color. So that's what genetics is. So genetically, there is you have a gene in you which probably causing your myopia. Now, the reason I'm going to stress about the later part is because there's something called as epigenetics. So even say genetically, if you are predisposed to get a number of say -5, but if you are not taking care of your eye health is poor, you're not following good eye care, then your number could go from -5 to -10. So that is epigenetic. So what is -5? If you're like genetically predestined to have it, we can't control that. But the -5 which you will probably get if you're going to not take care of your eyes, which is what is the most important thing, is excessive screen time, lack of exposure to sunlight, and environmental, most people who are mostly indoors, not really like outside. It's a known and proven fact that the refractive error develops because of these factors. In fact, so much so that post COVID there was almost a myopia, not only a COVID pandemic, there was almost a myopia epidemic, which we saw as eye doctors. We saw so many kids coming with these numbers in the eye because of excessive screen time. So any of you who have kids, younger kids, or even young adults, I think this is a very pertinent factor. Now, numbers usually will stop increasing by the time you're 21, but rarely it can also progress till you're 28 and 29. So but in the younger kids, for sure, I think epigenetics is a huge plays a huge role, and something which everyone as parents should be aware of, because most of the times I see kids are just given the mobile phone, given the iPad, just, and I understand it probably makes life easier for the parents, but that is absolutely detrimental for the child. Encourage them to go outside, encourage them to play outside, enroll them for more outdoor activities, swimming, tennis, badminton, whatever may be, but reduce their screen time, especially if your child's already started getting a number in the eye. Now, as I said, this is actually becoming an epidemic, where now we are seeing it is one of the leading causes of visual problems in children. And it is estimated that 70 million of the population in 2010 had high myopia. High myopia is where the number is more than -12, and in 1.9 billion were actually myopic. This is in 2010, and it is projected to increase way much more in the next 2025. It is a major public health concern that we are seeing in all the East Asian countries, and so much actually it's a lot more in East Asian countries, and probably like there's a genetic factor playing a role here, because this is not so much of a concern in Caucasians, but definitely more in East Asians, which includes us. So it has a significant impact, because first of all, if it's undiagnosed, then that can cause something called as lazy eye or amblyopia in children, where the vision of the eye becomes lesser, and we cannot correct that unless it's diagnosed. So first of all, diagnosis is very, very important, and once it's diagnosed, to make sure that it is treated properly. Now, how do you What is the cause? That's why I showed you the first picture, where if the eyeball elongates, if you have a longer eyeball, you have a minus number. Now, exact mechanism for this we do not know, but it is probably hypothesized that, you know, if you're doing a lot of near work and, you know, kids are continuously focusing on the screen, there is an impulse which, you know, the ciliary muscle which kind of gives an impulse to elongate the eyeball. Probably too technical for you all, but what you can remember is that yes, increased screen time, it's not a myth, it does increase your minus number. And how environment affects is that, because if you're not exposed to the sunlight, the UV light, that itself can, like in India, there's a big perversion to, you know, I don't know why the UV light, maybe because of tanning or whatsoever, but there's a big it has been proven that, you know, if a child goes and even plays outdoors in the sunlight, it is going to inhibit the axial elongation. So once that is all that is something which you're going to take care at home. But what are we going to do for you when you get the child to us? We can put the child on something called as, either, you know, we give atropine drops so as to relax those muscles of the eye, or we give myosmart glasses, where, what are these glasses? These glasses have have a technology in them which kind of does not allow that muscle to contract so much. It kind of allows the child to see but keeps the muscles relaxed. So that's our goal. You know, obviously you want the child to have the number in the eye and see, but also keep the muscle relaxed so that the number is not increasing. So and this technology usually we like for the first 1 year, you know, if the child takes these classes, if there's any jump in the number, here we give the the glasses, or the change is given at free of cost, you know, to the child, so that, you know, because we do believe in this technology, we do believe that this is going to help the child. So now what about in adults? Now in adults, is it possible to get free from glasses? Do you want to get free from glasses? Always when the patient comes and asks me, like, you know, doctor, should I go for LASIK? I always ask them, do you want to go for LASIK? That is the most important question which you need to answer, because my job is to tell you whether you're free from, whether you're fit for LASIK, and, you know, whether freedom for glasses from glasses is a possibility for you. But doing it is essentially a decision which you need to take. Are you doing it for cosmetic reasons? Are you doing it because, you know, some patients don't want to keep wearing those glasses each time they're driving, like they can't look at the dashboard and they can't look far? So are you doing it for those reasons? What reasons are you doing it for? Once you're clear on that, I think we have a huge range of options to treat you. We have PRK, LASIK, blade free LASIK, blade LASIK, smile, phakic IOL. So what exactly is corneal refractive surgery?
If a person has a refractive error, then light is not properly focusing on the retina in the back of the eye. People who have refractive errors may wish to consider LASIK as an alternative to wearing corrective lenses. LASIK is a surgical procedure that corrects refractive errors by changing the shape of the cornea, and thus the way the eye focuses light internally.
So basically, LASIK is just going to change the shape of your cornea, and I'll just show you a very small animation as to how it's done.
LASIK surgery begins with you entering the laser room and lying down in a relaxed position on the procedure bed. Next, anesthetic drops are applied to numb your eye. The surgeon will then position you properly under the laser machine. A painless lid separating device will keep you from having to worry about blinking or closing your eye during the procedure. Next, your doctor will use an advanced automated device to create a thin flap of tissue on the cornea, the clear front window of the eye. Your doctor will then gently lift this flap and hinge it back, out of the way. You will be asked to fixate on a blinking fuzzy red light, and your doctor will precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Painlessly, computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. Before you know it, your procedure is over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time.
So this is how LASIK is done, and you may ask, like, what is blade-free LASIK? What is contour LASIK? There's so many questions, most of the patients have in their mind. So this the flap that is raised can be raised with an automated instrument, or that also can be done with a laser, where it's an entirely blade-free procedure. Let me just here, as you can, the even laser bubbles, the cavitation bubbles are joining into the eye, and that's how the flap is being raised. I'll just show you the video for that.
During the laser cornea with a laser, the first step is to use a state-of-the-art femtosecond laser to create a corneal flap. In seconds, over 1 million computer-controlled pulses of laser light are delivered to the cornea. The beam passes harmlessly through the outer layers of the cornea until it reaches its exact focal point. Once at the predetermined depth of the cornea, the laser produces a series of tiny gas bubbles which join together to create the flap. With femtosecond laser technology, surgeons are now able to create a customized flap of a desired thickness, size, orientation, and location.
And about SMILE, I think it is the latest. This is a video, I think, actual video of. Sorry, let me just see if it's working. This is an actual patient video. You can see this is how it looks. The patient will see a green light. Patient keeps focusing on the green light. This is the surgeon's view when I'm doing the surgery. And there is, as you can see, there's actually no blade touching the eye at all. And yeah, you can see the laser has now made its first pass through the patient's eye. And that's it. Now you can see the flap has been made already. Now yeah, that's it. So this is how the bladeless LASIK is done, where now you've seen that none of the blade or any instrument has touched the eye at all. So now what is SMILE? Now a lot of patients are coming asking about SMILE. So even though LASIK has its advantages and it's a great technology, but if you can see that the flap is opened, it's around a 20 millimeter opening, where in SMILE it's a flapless surgery, where the opening is only 4 millimeters. So patients who are very active, like especially sports players, now you'll ask me, why are we not doing SMILE in everybody? Because there is a limitation. We cannot do SMILE with the numbers more than 9 diopters. If the cylindrical number is more than 2.5, we cannot do SMILE. If there's a plus number, we cannot do SMILE. So that's the few limitations of SMILE. But if you're having a low myopia, if you fit in all the criteria for SMILE, then this is definitely my surgery of choice now. I'll just show you how SMILE is done.
The lenticule all depends on the refractive error of your eye. This lenticule is then extracted through a very small incision, about 2 millimeters out of the eye. And that is how the shape of your cornea is changed.
So as you can see here, there is no flap at all. The laser has passed through the cornea, and the flap, the lenticule is made. This is called as a lenticule-based surgery, and through a very small cut, it is removed out from the eye. So this is how it is actually live in SMILE. Again, as you can see, this is my view when I'm doing the. I think there's some issue with the. I'm sorry, I think some issue with the video. So typically the view, it's similar to doing a femto LASIK, whereas like a suction cup is placed on the patient's eye. The lasers are passed, and we don't touch the eye at all. Only for removing the lenticule is where the surgeon is surgeon's play comes into the into that part of the surgery. Once the lenticule passes have been made, the surgeon goes and extracts the lenticule from the patient's eye. So that's where the surgeon's skill is comes in play, because to extract the lenticule without damaging the other areas, that's where the surgeon's skill is. So now if the patient's number is really high, I'm sorry, this Samir, I think the video is hanged. I think meanwhile, if someone has any questions, I think I'm almost at the end of my talk anyways. I'm just going to show another video where I'm showing about phakic IOLs, how the higher numbers are corrected. If your number is very high, like more than -12, we have patients who have very high myopia. If the number is really high, then in that point we have options where we are going to insert a lens into the eye, which is called as phakic IOL. These are very thin lenses. Let me just try if that works.
A state-of-the-art solution for addressing refractive errors is the use of phakic intraocular lenses. These lens implants are designed to be inserted within the eye, hidden between the iris and the eye's natural lens. Once in place, the phakic IOLs work together with the eye's natural focusing system to deliver sharper, clearer vision. Phakic IOLs are an ideal solution for nearly anyone who has the need or desire.
Doing this video is because some patients do have very high numbers, they're -14, -15. So then means where we can correct the numbers in them as well. So this is just again
to rid themselves of glasses or contact lenses. They offer patients an alternative to corneal refractive procedures, such as LASIK or PRK. Phakic IOLs have advantages over corneal refractive procedure and superior quality of vision. They can correct a wide range of refractive errors, including very strong errors. But need or desire arises, these lenses can be removed or updated to meet potential changes in your vision needs. Advantages of phakic IOLs go beyond their versatility and corrective strength. Several design features of the lenses make the implantation procedure safe, minimize recovery time, and minimize the occurrence of post-operative complications. If you have the need or desire for quality vision correction, phakic IOLs are not just an alternative, they are the clear choice for superior vision quality.
So how do we determine which surgery is best for you? Like I mentioned earlier as well, smile is definitely becoming my surgery of choice. But if you are, you fit in the parameters where it is a good surgery for you. So we look at the number of the eye, we do a thorough eye examination, we do a dry evaluation because LASIK is known to increase some amount of dryness. We look at your corneal topography, thickness. We look at how much number you have after, we put eyes drops in your eyes. When we look at the abrometry. So we just like evaluate very thoroughly. We are going to evaluate, like I've shown you earlier in the dry evaluation. This is a basic examination. Then we measure your tears. So all of this workup is done, in fact, even before doing your refractive surgery. So the goal is, if you're to make sure that your doctor is doing all of this. Now here we are checking for binocular vision because oftentimes patients, I have a lot of patients who get operated for LASIK with other surgeons, and suddenly they feel like their near work is affected because all of these issues need to be checked before surgery, whether you have any problems with your binocular fusion, and then we check your retina. This is how here we are now looking at your corneal shape and your corneal thickness. These maps tell us whether your corneas are suitable for LASIK. So here gives a fair idea whether, like, if you say your corneal thickness is very low, it's around 500, then your numbers, even if it's my number is -6, then you're not a candidate for most of the corneal surgeries. Then we're going to go into phakic IOL for you. So all of these tests are then going to tell us, which like it's a very customized, I would say, more like a tailor-made approach. I can't say it's like one size fits all. Once we look at your eyes, we know best, what are options available for you. So thank you so much.